Now, you have to remember that in the United States, 75 to 80% of what we spend is spent on chronic disease or the sequelae of chronic disease. So it's not your 22-year-olds who have, athlete's foot or whatever. It's chronic disease. And whenever you talk about chronic disease, in a rational system, you'd say, well, 75% of the money is going to chronic disease. Let's focus on that. That's a good place to really locate our attention and put our attention. But as we know, around the country, and you're an exception, which is why I often tell your story, most groups do not, in fact, focus on chronic disease. So there's a very famous study from the New England Journal. It's a few years old, but it's been updated recently, from McGlyn et al. And the title is The Quality of Healthcare Delivered to Adults in the United States. And McGlyn said, let's go out, and her team, they were at RAND, let's look at disease states for which there is an evidence-based standard. We know what ought to happen at that time. And let's go out and look in the charts of actual doctors in actual practices in the community, and let's find out if, in fact, what should happen is happening. And as you can see, in AFib, Salim wasn't working very well that day, nationally, 25%. And if you go down at the end of the study, there were more parts of it, the average success rate was 55%. Now, for those of you who went to medical school and were required to take calculus, it is possible to calculate that that means we had a 45% not doing exactly what was necessary. 45% in almost any business or industry of an error rate would not work. If you went to a hotel that did the right thing 45% of the, or 55% of the time the wrong, they would not have good reviews on TripAdvisor.com. But it turns out that this study is wildly overstated to the positive. Because in this study, what they did was the evidence-based standard was listed as a function of whether, for example, in hypertension you were on an ACE or an ARB, whether in CHF you were on a beta blocker, or whatever. It had nothing to do with your blood pressure. So if the patient came in, had 10 milligrams lisinopril, and a pressure of 189 over whatever, that was still considered a success. So it was a process measure, not an outcome measure. Big, big, big difference. And when you actually look at average outcomes nationally, and you all are now part of this, there is a big push to get 80% of patients to goal for blood pressure. The current rate in the nation, not here, is 40%. There's a triple goal, we use a 5-way, and 12% across the country of diabetics have the right BP, LDL, and A1C. Osteoporosis screening, not happening an awful lot of the time. Correct asthma meds, 1 out of 14 patients. For those of us who worked on the asthma team, you remember the asthma protocol is amazingly prescriptive as to exactly what drugs you should write if you carefully follow the process. So that evidence-based standard gets down to exactly what meds should be ordered for a patient. So my point would be, if nationally we're spending 75% of our money and we have, as a nation, a failure rate at these dimensions, of course healthcare is outrageously expensive. We're not doing very well, not you, we, but the larger national very well. And quite frankly, in the work that we started in this group in 2004 and 2005, we have done quite a lot better.